and share my screen. Attempting to share my screen. There we go. Okay. Welcome, ladies, and welcome to Heart to Heart. And I just wanted to have an intimate conversation to promote heart health for women. My aim today is to simply empower you guys to prioritize your emotional well-being for your overall heart health. And I do this because of my personal connection. So back in the late 90s, early 2000s, I worked in corporate America. I worked for one of the major Fortune 500 companies here. I was in school attaining my PhD, a very stressful position, and had 3 surgeries in 3 years, as well as a procedure where they had to go in to do a heart catheter to see if I had any blockages. I did not, luckily I did not. However, they did find that I have what's called mitral valve prolapse. I have where there's a leaking in my mitral valve. But at the end of the day, with all of the surgeries that I had to have my gallbladder removed, and a couple of other things done. But with all of that, it all came down to stress. That's what the cause was. And that really made me aware of the need to prioritize heart health and to begin to do the things that are necessary to promote my well-being and to become an advocate, just to help other women to be aware that, guys, yes, it's the things that we eat can contribute to poor heart health, but when we suppress our emotions, that can also contribute to the decrease in our heart health. So go red for Heart Health Day. I have loved this day ever since I can remember. I believe in going red. I love red, but it's an empowering color, and it empowers women. And it's a reminder. Red reminds me of love, and it reminds us to love our hearts. And we know that Go Red for Heart Health Day is a campaign that's dedicated to raising awareness about heart health, particularly women's heart health. So this morning I told my husband, I told my son, wear your red, wear your red. And my son was like, I was actually wearing my red suit today, Mom. I didn't realize what today was. So I'm a huge advocate of this day. But I would like for the numbers to tell the story for us. So we know that cardiovascular disease is the #1 killer of women, and it causes 1 in 3 deaths each year. It impacts women at higher rates than it does men. And the simple truth is that most cardiovascular diseases can be prevented with education and healthy lifestyle changes. There are some that cannot. There are some that are hereditary, but there are a lot of things that we as women can do to promote a heart that's healthy. And heart disease and stroke can affect women of any age. I was in my mid-30s when I started having severe chest pains and difficulty breathing. So we have to not look at it as something that impacts women who are elderly, right? It impacts all of us. So looking at, I'm sorry, ladies, looking at these numbers, 44%. So cardiovascular disease, as I mentioned, kills more women than all forms of cancer combined. Yet, only 44% of women recognize that cardiovascular disease is the greatest health threat. And then there's women 20 years and older, nearly 45%. So we look at that 45 and 50% number. Nearly 45% of women 20 years and older are living with some form of cardiovascular disease. And less than 50% of women entering pregnancy in the United States have good heart health. And to me, that's alarming, being in a developed country as we are. That's very alarming for me. And then number 1, as I stated, cardiovascular disease is the #1 killer of new moms, and it accounts for over 1/3 of maternal deaths. And Black women have some of the highest maternal mortality rates. Then we see the numbers 10 to 20%. So 10 to 20% of women will have a heart health issue during pregnancy. And some of those issues are high blood pressure, preeclampsia, gestational diabetes. Those are just some of the issues that come up. And those issues greatly increase a woman's risk of developing cardiovascular disease later in life. Then there's that number 51.9. And 51.9% of high blood pressure deaths, otherwise known as hypertension, or the silent killer, right? 51.9% are in women, and out of all women, 57.6% of Black females have hypertension, which is more than any other race or ethnicity. And then 4.1 million. There's an estimated 4.1 million female stroke survivors living today, and that's great. That is wonderful. But of that, approximately 57.5% of total stroke victims, stroke deaths, are women. So that's something that we as women need to be very, very mindful of. So our next slide, emotional well-being. And emotional well-being refers to the overall mental health and balance of emotions. And that's something that's really big for me. I am a faith-based clinical counselor and life coach. I'm also trained in brain health education. So I do a lot of work around how our emotions affect that brain response and how it affects our gut health. So that gut, brain, emotion, that's my lane. That's the lane that I'm in, which prompted me to talk about emotional well-being and how if we're not doing well emotionally, it really impacts our heart health. But we know that emotional well-being refers to the overall mental health and balance of our emotions. And it encompasses the ability to understand, to manage, and to express our emotions in a healthy and constructive manner. Emotional well-being involves feeling a sense of contentment, resilience, and inner peace. And we feel those things even in the face of life's challenges. So when we're doing well emotionally, we understand that things will happen, but we're better able to deal with those things that may come up. And it goes beyond the absence of mental health disorders. Emotional well-being extends to the presence of a positive emotional state in all that we go through. So there are some key aspects of emotional well-being that I would like to talk about today. One is self-awareness. And self-awareness involves being attuned to our emotional triggers and our responses. It's really sitting with ourselves and gaining an understanding of what it is that causes us. When you hear, oh, she went from 0 to 10, what really causes us to go from 0 to 10? Or what causes us to just not feel so well? It can be the weather, it can be a certain smell, but we have to be fully in tune with what triggers our emotions and causes us to move from that state of well-being to a state of unease or unrest. And there's emotional regulation. And emotional regulation is our ability to manage and control our emotions in a way that's adaptive and socially acceptable. So that goes back to that 0 to 10, right? We can't just go off yelling and screaming and stumping and having a fit. We have to recognize, okay, when I'm becoming upset, my heart begins to race or my hands begin to sweat. I need to step back. I need to be able to control. I need to be able to calmly go and engage in a conversation. So that's emotional regulation. And it also includes coping with stress, right? Coping with frustration and being able to effectively handle disappointment. Because again, we know in life, things can go great, but then something will happen. And we have to be able to manage that in an effective way. And then positive relationships. Nurturing and maintaining meaningful connections with others and healthy social interactions, they all support systems that are crucial for emotional well-being. So it's making sure that we have that group of positive influence that's around us. So even when we're having our bad days, there's someone there that can lift us up. And then life satisfaction. And that's feeling a sense of purpose, fulfillment, and overall satisfaction with our lives. We may not have everything we want, but we've learned to get in a space where we're happy with where we are. We may be striving for more, but we don't allow that striving for more to bring on undue stress that can, of course, trigger a negative heart health. So when we acknowledge and we address our emotions, we have to remember that it's essential for maintaining our emotional well-being. We have to be in tune with who we are and how we respond to things. And that leads to emotional awareness and why it's important, right? It's important that we're aware of our emotions. One, because it promotes promotes a positive mental health. When we acknowledge and when we understand that our emotions, that allows us to identify and to address mental health concerns before they escalate. It also enables us to proactively take care of ourselves. And it alerts us when, hey, we may need to raise our hand and seek help and say, it's a little bit too much. I just need to talk about this. And being aware of our emotions enhances self-awareness. Recognizing and processing emotions fosters a self-awareness. It helps us to understand our own needs, our own desires, and our own values. And this self-awareness is fundamental for our personal growth and our development. And then being aware of our emotions improves relationships. When we address emotions, the things that we feel or how someone makes us feel, it promotes healthy communication and conflict resolution. And when we do that, it helps us to express ourselves. We can be more authentic. It enables us to understand the emotions of others better, and it contributes more to more meaningful connections. And then being aware of our emotions reduces stress. When we ignore or suppress our emotions, it can lead to stress and emotional discomfort. However, when we acknowledge and address our emotions, we're able to reduce stress. We're able to develop a more positive overall well-being in life. And then being aware of our emotions boosts our resilience. Studies have shown that emotionally resilient individuals are better equipped to bounce back from setbacks and negative impacts in life's challenges. And by acknowledging our emotions, that's a key component to building that resilience. So recognizing the importance of addressing emotions is crucial. It's crucial in maintaining mental health, but it's also crucial in creating a foundation for a fulfilling life. So where's that connection? Where does the connection lie between emotional well-being and heart health? And that connection is very intricate. Emotional well-being significantly influences cardiovascular health, and it influences factors such as stress, inflammation, and both of those play crucial roles in the relationship with cardiovascular health. Chronic stress can have detrimental effects on our cardiovascular system. When we experience stress, our bodies go into that fight or flight response. And when that's activated, it leads to the release of stress hormones like cortisol and adrenaline. And prolonged exposure to these hormones can contribute to things like high blood pressure, increased heart rate, and elevated levels of inflammation in the body. And all of these are risk factors for heart disease. And over time, and we'll look at that cycle in a little bit, but over time, chronic stress may contribute to the development and the progression of conditions such as hypertension and excuse me, I'm not able to speak today. Atherosclerosis, which are key contributions to heart-related issues. And then there's inflammation in the heart. Inflammation is a natural response of the immune system. It's the response that our body gives us when we're injured or if we have an infection. That's normal. However, when we experience chronic inflammation, which is often associated with conditions like chronic stress, that level of inflammation can lead to the impact on our cardiovascular system. And persistent low-grade inflammation is thought to contribute to the development and the progression of arteriosklerosis, and that's where fatty deposits accumulate in the arteries, right? And it restricts the blood flow, and it increases the risk of heart attacks, and it increases the risk of strokes. And if you notice, when you look at your MyChart or your reports from your doctors, and you see those inflammatory markers such as C-reactive protein, or it may be listed as CRP, those are associated with the increased risk of cardiovascular events. So you want to be mindful of those when you look at your test results. And then emotional well-being, it's a protective factor. It can be a protective factor for us because positive emotional well-being has been linked to heart health. And as I mentioned, when we have good emotional well-being, we tend to experience lower levels of chronic stress, which reduces that burden on our cardiovascular system. So positive emotions are associated with lower levels of inflammation, which potentially provide protective effects against the development of cardiovascular diseases. And then there's the behavioral impact. Emotional well-being also influences behaviors that can promote or undermine heart health. When we experience chronic stress or negative emotions, we may engage in unhealthy coping mechanisms such as smoking, overeating, or physical inactivity. We may feel like we just want to sit, we don't want to do anything. And all of these are risk for heart disease. So that connection between emotional well-being and heart disease is mediated through the complex interaction involving stress, inflammation, and our behavior factors. So managing stress, cultivating positive emotional states, and adapting healthy coping mechanisms are important strategies for promoting cardiovascular health and our overall well-being. And when we integrate that emotional well-being into heart health management, we can see positive implications in both the prevention and the treatment of cardiovascular diseases. So I mentioned suppressed trauma. And I often do this workshop on the truth and just recognizing the truth and responding to that truth. And I use this analogy, so I'll date myself. When I was in school, we had those old wooden school desks, right? And if you set a child in one of those desks and you gave them a pen and you told them to press down as hard as they can on that wooden desk, in the beginning of the school year, that would be a faint line. You would see a faint line. But if every day the only task that child had to do was press down as hard as they could, at the end of the year, there would be a deep indentation in that spot. The same is true with our brains. When we experience emotions, especially emotions that are negative or that cause us anxiety or fear, let me back up. Our cerebral cortex, which is like our own little mini computer, we form what's called memory traces. And those memory traces, if linked to bad memories, fears, rejection, things of that nature, the more it develops that memory trace and the more we think on it, the deeper it gets. And ultimately, that experience, anything now in life that looks like that experience, feels like that experience, now becomes that experience. So that's what we view life through. And when we go through things and we suppress them and we don't deal with them, then that suppression, that's a psychological mechanism where we unconsciously, we bury and avoid acknowledging things. But when something looks like or seems like that thing, that trauma that we've suppressed, it automatically becomes that thing. And when we suppress and ignore, it can result in, one, of course, us not getting the help that we need to deal with the trauma, but it also leads to various long-term effects on our mental and our emotional well-being. And understanding that link, understanding how trauma can be suppressed, and recognizing the signs of unhealed emotional wounds are crucial for effective intervention and support. So I just want to share just a few things surrounding that. So two suppression mechanisms, let me start there, that we tend to use. One is disassociation, and that's where we just may disconnect. We disconnect from our emotions and any memory that we have that's associated with that traumatic event. We don't deal with it. And this disassociation, it can create a barrier between us and the emotion. And it allows us, right, to move on without thinking about it, but it also makes it challenging for us to recognize or recall the trauma consciously. That's what it does. That's what that barrier does when we disassociate. So we may be in a conversation that triggers something, and we may not even realize that we're being triggered by what's being said today because of a trauma that we experienced maybe 10 or 15 years ago, because we've totally disassociated ourselves from that emotion. And then there's compartmentalizing. And that's when traumatic memories and emotions, we compartmentalize them, we isolate them so that we're not consciously aware. And when we do this, it allows us to function in daily life without being overwhelmed by the pain that's associated with the trauma. So we don't want to carry that trauma with us day after day after day, but we don't want to suppress it either. We want to be able to raise our hand and say, hey, my support group, I need to talk about this, or hey, I need to get professional help for this, or hey, my spiritual group, I need to talk and pray about this. We don't want to go around with all of that suppressed trauma, because that's the things when you hear, oh, she went from 0 to 10, it's because something triggered us and took us back to that trauma. So here are a few common signs of suppressed trauma. There's avoidance, and that's that persistent avoidance of situations, of places, or conversations that may trigger memories or emotions that's related to the trauma. There's emotional numbness, difficulty experiencing or expressing emotions or feelings. We become emotionally detached from ourselves and also from others. There are flashbacks or intrusive thoughts. That's those unexpected and intense recollections of a traumatic event. And it's often triggered by something that stimulates a memory for us. Or we may find that we're hyper aroused or hyper vigilant. And that's when we have that constant alertness, or we have an exaggerated startle response, or a difficulty relaxing. And I know for me, I was sharing with Maureen when we first got started, that one of the things that prompted me to do this is because when I was in corporate America, I had 3 surgeries in 3 years, and it was related to stress. And I remember I would go to the nail salon and they would tell me, relax, relax your hands, relax your hands. And I could not relax. And I would go to have a massage thinking a massage is going to relax me. But the massage therapist would say, ooh, you need to let go. You have to relax. And all of those are stress responses. It's because we're suppressing things. I had issues at work and I was suppressing them because I just had to get in there, deal with it, get the job done. So it can come out as exaggerated startle response or that difficulty relaxing. And as women, that's a big one for us. You know, we just go, 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 go. And we say, well, we just have to do it. But if we really sit with ourselves and ask ourselves, what are we avoiding? What is it that we don't want to deal with? Is that why we're going, going, going? And then there are physical symptoms, right? Unexplained physical symptoms such as headaches, digestive issues, or chronic pain. All of these things can manifest due to unresolved emotional distress. And of course, difficulty trusting others. There's a deep-seated fear of vulnerability, and we face challenges in forming or maintaining trusting relationships. So if you're experiencing any of those, you may want to really sit or talk with someone to figure out what's the root there. Is there some suppressed trauma that you may be dealing with? So there's some behavioral patterns. There's self-destructive behavior, right? That's when we engage in behaviors that may harm us. Behaviors such as substance abuse, self-harm, risky activities. All of these are a way of coping with unresolved trauma. And unconsciously, there's that repetition of traumatic patterns. And that's when unconsciously we reenact the elements of the traumatic experience in interpersonal relationships or in our daily life. So that's when our responses, or to get ahead of that trauma so that trauma won't happen to us again, we automatically take the lead and begin to respond as though we're in that trauma again. And then it leads to an impact on our daily functioning. We have impaired cognitive skills, and that's where we find we have difficulty coping with stress and difficulty adapting to the normal challenges of life. And that's due to the emotional burden of that suppressed trauma. And then there's interference with relationships. There's that struggle in forming and maintaining healthy relationships because that unresolved trauma contributes to difficulties in things like trust, communication, and our emotional intimacy. So there's physical health manifestations also when it comes to suppressed trauma, and that's chronic health conditions, because suppressed trauma has been linked to the development or the exacerbation of physical health conditions. As I mentioned, cardiovascular issues, excuse me, autoimmune disorders, and chronic pain. And recognizing suppressed trauma requires a compassionate and an observant approach from ourselves as well as our support system. And it's essential for us. It's essential for us and for those around us that offer us their support to be aware of the signs and the symptoms of suppressed trauma, because early identification can begin to pave the way for appropriate therapeutic interventions and support. Professional mental health guidance is often something that's crucial in helping to navigate and to heal from suppressed trauma, because it fosters a path towards emotional well-being and resilience. So chronic stress, as we know, it can have profound physiological effects on our body, particularly in the cardiovascular system. And there are several studies out there that explore the links between emotional trauma, chronic stress, and heart health issues. It sheds light on that interaction between our physiological factors that can impact the well-being. Those factors that when we suppress, and the behaviors that we delve into to kind of cope with the suppressed trauma that affects us physically. So I just want to take a quick look at what happens when we suppress our emotions. So first, there's the activation of the stress response, right? Something triggers us, causing that activation. And when we have chronic stress triggers the body's response system, that fight or flight system that we have. And it increases our heart rate. It increases our blood pressure, and it increases our energy metabolism. And it's good when we're truly in danger. We want that fight or flight system to be triggered. We want it to activate, because if there's something coming at us, like I walked into my front yard the other day and there was a little baby fox just in the front yard. So I needed my fight or flight to tell me, go back into the house and go into the house quickly. But we don't want that going on all day, every day. So once it's activated, then instead of dealing with it, right, that's where we allow our bodies to remain in that state of fight or flight, which can cause a buildup of inflammation in our bodies. And prolonged exposure to stress hormones can contribute to chronic inflammation. And as I mentioned, inflammation itself It's a natural part of our immune system. But when it becomes chronic, that's when it's associated with various health issues, including cardiovascular disease. So now the stress hormones have been activated. We're in that constant state of fight or flight. We have chronic inflammation in our bodies. So there's that buildup of inflammation from the chronic stress, which can then lead to a suppressed immune function. And a weakened immune system can make us more susceptible to infections, and it can contribute to overall health challenges. So now we're dealing with a triggered stress response, chronic inflammation, a suppressed immune system, and we may also then begin to see an impact on our blood pressure. That's because stress-induced inflammation and just stress itself increases the blood pressure. And if it's chronic, if our blood pressure is elevated and it's chronic high blood pressure, that can contribute to the development of things such as hypertension. And hypertension, we know, is a significant risk for stroke and heart disease. Then there's the dysregulation of the autonomic nervous system. And that's when chronic stress, it leads to that dysregulation. And the autonomic nervous system, we know it controls our involuntary bodily functions such as our heart rate and our digestion. And this deregulation can contribute to cardiovascular issues. And that kind of leads into that brain-gut emotion connection. But chronic stress, and I just wanted you to see it. I talked about it, but I wanted you guys to see it in its cycle and what it looks like. Because chronic stress and emotional suppression can induce psychological responses, physiological responses that over time can contribute to significant cardiovascular issues. And then the role of emotional healing is crucial for preventing heart issues, because emotional healing addresses the interconnected nature between our mental and our physical well-being. Emotional well-being practices can contribute to stress reduction. It can contribute to improved coping mechanisms, and it has a positive impact on our cardiovascular health. So while each of us may experience varied emotions and varied stress levels, there are many success stories out there, many case studies that highlight the potential benefits of prioritizing emotional well-being in preventing heart issues. So when it comes to stress reduction and health, heart health, like I mentioned, there are numerous studies out there that suggest stress reduction techniques such as mindfulness meditation, deep breathing exercises, and relaxation therapies can all positively influence our heart health. And these practices help to lower stress hormones, reduce inflammation, and promote a more balanced autonomic nervous system. So I want to leave you guys today with a few practical strategies. One, seek professional help when needed. Raise your hand. If you need to talk to a professional counselor, if you need to talk to clergy, if you need to be a part of a support group, it's more brave and takes more strength to raise your hand than to allow those emotions to sit and to suppress them. Practice mindfulness things, practice journaling, practice meditation. Kind of delve into expressive art therapies, things such as music, dance, drawing. Those types of things help to bring about a calmness. Then there's journaling. You may want to practice journaling. As I mentioned before, connect with supportive communities. Consider healthy boundaries, right? Establishing healthy boundaries. Learn to say no. Setting boundaries is crucial when we manage stress, and it's crucial in preventing re-traumatization. And if you don't take anything else away from today, Remember that no is a complete sentence. It is okay to say no without any qualifiers. And practice self-care, whether it's reading, walking, going to the spa, sitting, and just being still with yourself. Practice self-care. And then proper nutrition and physical health are important as well. When we love ourselves, we are taking care of what we eat and how we move our bodies. And then educate yourself. Learn about trauma. When we begin to understand the physiological and psychological effects that trauma can have, it empowers us in our healing journey. And then education also helps to demystify the experience of the trauma. And it reduces feelings of isolation, because when we begin to educate ourselves, we begin to understand that there are other people that may have experienced what we've experienced. And then professional body work, that's massage or some type of body-centered therapies, because physical touch through massage can help to release tension, and it helps to get the trauma out of the body. It helps to release the trauma that's been stored in the body. So it's important, though, ladies, to note that addressing suppressed trauma is a gradual process. It won't happen instantly. And you may find a combination of these strategies may work best for you. You can seek help from trained mental health professionals, but overall, remember patience and self-compassion are key components to healing. So do you ladies have any questions for me? I know that was a lot, and I went a little fast because I wanted to be mindful of your time, but do you guys have any questions at all?
Hi, this is Maureen.
Hi.
Hi, I have a question about some struggles finding the root of what's going on. When I start to feel stressed, I can feel it. I know what it's like. I can feel things kind of crunching up, but I can't always sit down and identify what's going on. Are those times I note it and try and figure out later, or are there methods I can go through to try and understand what's going on better?
Those are times I would say, if you're in a position to pause and really reflect and ask yourself, kind of think back, before I felt this way, what was going on? What may have been said? What did I see? Even you would be amazed how smells trigger certain responses in us. But there's also, if you wanted to take just a deeper dive yourself, if it's issues of things that maybe you need to forgive, things that you may have suppressed, I do a lot of book discussions. And right now we're coming to the end of a book discussion on a book by Lisa Turquoise called Forgiving What You Can't Forget. And there are a lot of great practicals that she gives in that book that help us to begin to identify things that were given to us in our formative years that cause us to respond and view life a certain way.
Okay, yes.
Yeah, yeah.
Okay. Oh,
Yeah.
that's going to help. Thank you so much.
Oh, you're welcome. Yes. Did anyone else have a question?
Yes.
Yes. Okay. So I have a call to action for you ladies. Empower your heart, empower your life. Remember that. Empower your heart, empower your life. So my challenge is to take charge of your cardiovascular health today. Schedule a heart checkup, prioritize regular exercise, embrace heart healthy eating habits, be mindful of stress, right? Choose one, choose all of those things, but take charge of your cardiovascular health today. Share your knowledge about heart health with the women around you. Begin to foster a community of care and awareness. So let's commit to making heart health a priority, not just for ourselves, but for generations to come. Because together, you, me, each and every one of us can ensure that every heartbeat counts. So I encourage you, I ask of you, please join me in spreading the word, in taking action, and in creating a world where women's hearts can thrive. So your heart, your power, right? So let's make heart health a lifelong commitment. And I would love to stay in touch with you guys. I will send out the link of the recording, but let's stay in touch. You can email me at drcrystal@thedrcrystalc.com. You can find me on Instagram at just Dr. Crystal, and on Facebook at Dr. Crystal M. Consinary, Christian counselor and life coach. So just go red. Red is a powering color. Let's be powerful today, ladies, and let's do one thing today that improves our heart health. So thank you, ladies, so much for joining me here today. You guys have an amazing, amazing rest of your afternoon. Thank you all.
Thank you so much.
Okay.
Thank you. Really appreciate it.
All righty.
Thank you.
Bye-bye.